Hi, I'm Dr. Daniel Golshani. I'm a board-certified plastic and reconstructive surgeon. Today I want to speak with you regarding what to expect from your plastic surgery consultation. The plastic surgery consultation is the first time that you arrive and meet your plastic surgeon at their office. And to me, it's a time when the plastic surgeon can meet the patient, understand the problem that they're presenting with and what their expectations are, be able to review the patient's history pertaining to the problem, possibly if they've had previous operations or previous health-related issues, and to get a good sense of how they can relate to the patient and how they can ultimately help the patient get to their desired goal. Your consultation begins with the history-taking process, where it's very important for me as a plastic surgeon to understand the history of your presentation, the problem that you have at hand, whether it is a straight case of wishing to have larger breasts or liposuction, or whether it's a more complicated situation where there has been previous treatments, previous surgeries. And the history of present illness, as we call it in medicine, is a way that we take a history to understand really what happened, what needs to be done, what are the patient's wishes, which sometimes even the patient is not aware what their wishes are until they come to consultation and we sit down and we talk. It's also a very important time because you as a patient get to know who I am as a surgeon and whether I am the right possible surgeon for you, and we can bond in a process of doctor-patient relationship, developing a trust where it's so important for the physician to be able to ultimately help you get to your goal, to set your expectations correctly so that you're satisfied with the outcome at the end, and reach a common place where I as a surgeon can be very happy and satisfied that I've done what I had promised to do for you. So first we begin with the history of present illness. After the history of present illness, we move on to your past medical history and your past surgical history. For me as a surgeon, it's very important that I can understand your health-related issues, if you have any, whether you're taking any medications, any herbs, vitamins, even aspirin or non-steroidal anti-inflammatories. Sometimes patients, when you ask them, do you take any medications, they'll say, no, I don't take anything. But if you probe, you'll find that, well, they might be taking fish oil, or they might be taking ginkgo biloba. And these are all very important for us as surgeons because they could have an effect on the outcome of your surgery. And it's very important for us to have a good list of your medications and your supplements. The past surgical history is equally important. When we decide what sort of procedure to perform and what type of anesthesia or anesthetic to provide, the surgical history is very important. The family history is also very important. Some patients may have a family history of blood clots or clotting issues or anemia, and these are important facts that a surgeon needs to know. The family history of breast cancer is very important anytime we discuss any form of breast surgery, breast augmentation, breast lift, or breast reduction. There always needs to be a conversation between the plastic surgeon and the patient about the risks of breast cancer, prevention of breast cancer, diagnosis of breast cancer, and what the routine modalities are. And as a plastic surgeon, it's important for you to have this discussion with the patient to ensure that the patient is educated as you move on and proceed forward. Social history is very important. The usage of tobacco obviously is very important. I know of very few plastic surgeons who feel comfortable operating on a patient who is actively smoking. The reason for this is that smoking has many negative side effects that can affect the patient. The patient who smokes can have a chronic history of bronchitis. They could have airway disease that could affect them. For example, developing asthmatic symptoms after the procedure. Carbon monoxide, which is a component of cigarette smoke or even marijuana smoke, can have negative consequences in terms of tissue perfusion. And tissue perfusion means whether your skin or the area that we're operating on gets adequate blood supply. This is very important because in plastic surgery, everything we do is about fixing, rearranging, or moving or augmenting a body part and keeping it perfectly healthy. We're not removing things as much as, for example, a general surgeon or a neurosurgeon, but we're augmenting things and improving them. And so for us, tissue perfusion is very important. Therefore, patients should avoid smoking if they're planning to have plastic surgery, and this is something that we will discuss. This includes, by the way, marijuana smoke. The review of systems is the final segment before a physical examination is performed. We ask you general questions to see if there's anything that we've skipped over. If you have any chronic headaches, do you get asthma, do you have chest pain, do you have shortness of breath, do you exercise? If you exercise, what kind of exercise do you do? For example, if you're a bodybuilder and you're wishing to have breast augmentation, it's very important for your plastic surgeon to know that. If you're a push-up champion, it's very important for your plastic surgeon to know that, because that could potentially affect the positioning of the implant with respect to your pectoralis major muscle. If you're a bodybuilder, we may choose to place the implant definitely over the pectoralis major muscle. So these are all factors that are very important. It's very important to communicate these things with your surgeon. Also, a psychological history is very important. Having repeated episodes of anxiety attacks is something that can be a factor in your recovery. Having a chronic history of depression is something that can be a factor in your recovery, and these are very important to discuss with your surgeon. After history taking, the next big step is a physical examination. During the physical examination, my team and I will assess any complaints that you may have regarding your body and improvements that you wish to have. You will be able to, for example, try implants at this time and choose the size or shape that you desire. And it's a very educational process. The physical examination itself may not be a very prolonged duration, but it's a time when the patient gets to actually understand personally what their wishes are, and we further communicate with the patient about what we can accomplish, what the problems are. And this is also a very important time for you to address any concerns you have that you would like to bring up with your plastic surgeon. Finally, you may ask yourself, why do we go through all of this, and why is this such a complicated process? The reason we perform all of these steps in a consultation is to better understand who you are, to be able to perform any procedures for you in the safest possible manner and with the best possible outcome. It's my wish for my patients to be safe as they could be anywhere, and to have the best possible outcome they have. My team and I are going to be there with you throughout the course of your consultation. We want you to meet and know our patient coordinators who are here, and they will be with you as you proceed forward, to bring you back for further consultations if necessary, to retry implants, or to have more conversations with me to try to address your questions. But the purpose of all of this is for us to have a happy outcome, an excellent result, where you can be happy and proceed forward with your life in a life-changing positive direction. That is our ultimate wish for you.